Welcome to Breast Cancer Action's webinar, Communities Impacted by Fracking Coast to Coast. Thank you so much for joining us today. My name is Saru Kaiser, and I'm the Program Manager here at Breast Cancer Action. Joining me on the webinar, we have three wonderful presenters. The first is Athena Arguello, who's the Executive Director of Physicians for Social Responsibility, LA. We have Juan Flores, who is a community organizer at the Center for Race, Poverty, and the Environment, and Kern County, who's the founder of Burke's Gas Truth. A few quick announcements before we get started. Breast Cancer Action doesn't take money from any corporation that profits from or contributes to the breast cancer epidemic. Our work is largely supported by individual donors. Please consider making a $25 donation today to support work like these educational webinars. Our presentation of communities impacted by fracking coast to coast will last about 45 minutes. At any time during the webinar, you can ask a question by typing it into the question bar on your right. We'll save time at the end to answer all the questions that we can. We want you to get involved with Breast Cancer Action, and this webinar is a great way to do that. Please stay tuned for other ways we'll mention later on. So I want to take a moment just to talk through the agenda for today. Our talk today is really focused on the harmful impacts that unconventional oil and gas extraction has on our health. And while we recognize that unconventional oil and gas extraction is happening across the country, we even had news today that, or yesterday, that activists in Florida recently stopped a bad fracking bill from passing. Today our speakers are really focusing on the impacts on communities on the west and east coasts. We'll begin with Marta, who will talk about dangerous oil and gas extraction in the LA area and how urban drilling is impacting the health of Los Angeles residents. Juan will then talk about dangerous oil and gas extraction in Kern County and how drilling in the agricultural hub of California is impacting the health of residents and beyond. And finally, Karen will talk about fracking in Pennsylvania and the impacts it has on the health of Pennsylvanian communities. I'm going to take a moment just to talk a little bit about who Breast Cancer Action is. Our organization was founded in 1990 by a group of women living with breast cancer who realized the power of the community. They founded Breast Cancer Action because they saw a need for a grassroots organization with a unique understanding of the political, economic, and social context of breast cancer. Our founders, only one of whom is still alive today, knew that their private medical crises were part of a larger public health emergency. It was important that the experiences of those dealing with breast cancer be heard to address the crises. We're the only organization that addresses the breast cancer epidemic at the intersection of breast cancer, the environment, social justice, and feminism. And our mission is to achieve health justice for all women at risk of and living with breast cancer. We recognize how issues of health and social justice are really intertwined through the work that we do. They're a foundation for our core values around ending the breast cancer epidemic. That's why we've made a real clear commitment to social justice as the foundation of all of our work, and I want to talk you through just a couple pieces of what that means to us. We know that there's an unequal burden of breast cancer. The breast cancer epidemic impacts communities unequally, and it leads to unacceptable differences in who develops breast cancer and when it develops, who gets high quality and timely treatment, and who dies from breast cancer. The root causes of health inequities in breast cancer also must be addressed in order to end the breast cancer epidemic. These root causes are often the result of a complex interplay of culture, power, economics, racism, and sexism. The third piece of it that we believe is that there's no single injustice that can be effectively addressed in isolation. We recognize that injustices in our society reinforce each other in many ways and at many different levels. And last but not least, in our work for health justice, we strive to be an ally by using the power and privilege we hold as an organization to build solidarity with communities who currently or traditionally have had less access to power, information, and resources. So what do we actually do? That was a lot about sort of our foundational thinking. So as the watchdog of the breast cancer movement, we educate, organize, and take action for systemic change in three main areas. Our work on diagnosis and treatment examines the data from a patient perspective. It includes working on issues such as breast cancer treatment and screening, healthcare access, drug and device approval, and demanding for more effective, less costly, and less toxic treatments. Our second is our work to address the root causes of the breast cancer epidemic by focusing on eliminating the involuntary exposures to hazardous and toxic chemicals present in all of our daily lives that put us at risk for breast cancer. And our last priority recognizes that pink ribbon culture and marketing often exploits a disease that devastates communities, misrepresents who is affected by breast cancer, and excludes and marginalizes women's diverse lived experiences of the disease. We address the true impact that breast cancer has on women's lives and communities. So I'm going to talk a little bit about our three presenters. Our first presenter is Athena Arguello. For the past 35 years, Marta has served in the nonprofit sector as a health educator, policy advocate, and coalition builder. She joined Physicians for Social Responsibility LA in 1998 to launch their environmental health programs and became the executive director in November 2007. She is committed to making the credible voice of physicians a powerful instrument for promoting social and environmental justice. She has built numerous successful advocacy coalitions addressing a wide range of public health problems. She serves as the chair of the steering committees for the Californians for Pesticide Reform and Californians for a Healthy and Green Economy. She is also part of the South Los Angeles Building Healthy Communities and a founding member of Stand Together Against Neighborhood Drilling. In 2006, 2013, and 2015, she was appointed to the California Air Resources Board's Global Warming Environmental Justice Advisory Committee. Welcome, Marta.
Well, thank you.
Our next presenter, Juan Flores, was born in Colima, Mexico, and raised in Mexicali, Mexico. With his parents, Juan immigrated to Delano, California. He's the proud son of parents who are farm workers in the Central Valley, and he is the second of 3 children. At the age of 14, Juan worked as a farm laborer in the grape fields during the summer months of vacation from Delano High School. Juan has also worked at a dairy where he saw firsthand the dangers of working in a non-regulated dairy. Prior to joining the Center for Race, Poverty, and the Environment, Juan was a family advocate in Delano, California, where he advocated for low-income families to obtain free child care for their children. Juan has always had the heart of an organizer, and it is demonstrated with all the work he has done when he's not working. He possesses an associate degree in medical assisting. He is also an active member of Consejo para los Federaciones Mexicanas. He is also the secretary of Club Unidos por Cuauhtémoc, Colima. Welcome, Juan. And our last presenter, Kern County, is the founder of Burke's Gas Truth, a grassroots anti-fracking organization in Pennsylvania. She is also the co-founder of the statewide coalition Pennsylvanians Against Fracking and serves on the steering committees of both Americans Against Fracking and Stop the Frack Attack. Welcome, Karen. I'm now going to turn it over to Marta.
So hello, and I hope you all can hear me. So as you heard from my bio, I came to PSR almost 16 years ago, but what you don't know from my bio, oh, that's moving much faster than I expected it to. What you don't know from my bio, that I actually came to this work from the breast cancer community. And so the issues related to health and the environment have been something that has been very important to me. So can you slow that down? Can you, I don't know, it's moving much faster than I had my timing. Anyway, so STAND is Standing Together Against Neighborhood Drilling. We came together as a coalition to address a number of growing concerns we had from residents who were living near oil extraction sites in Los Angeles. And one of the things that we forget about Los Angeles is that Los Angeles was built on oil. So we came together to really figure out how to transform Los Angeles from an oil extraction city to one that could be powered by solar. Next slide. So our members are Physicians for Social Responsibility, Esperanza Community Housing, Redeemer Community Partnership, Holman Methodist Church, and Communities for a Better Environment. And we are fortunate to have a partnership with Liberty Hill Foundation, who has been helping us raise funds to address these issues. And we have researchers, nurses, mothers, parents, and families, and lots of wonderful youth that are part of our coalition. Next slide. So we've been working together to address this issue of urban drilling and what we don't, again, so Los Angeles was built on oil. In fact, one of the first millionaires in Los Angeles was Doheny. And there we go. So what is neighborhood drilling? It's drilling that happens in your hood. It's where you live. It's where you go to school. And in Los Angeles, that's 130 schools, 184 daycare facilities, 213 elderly homes, and that's nearly 628,000 residents that live within half a mile of an active oil well. So that's half a mile. And so we know that an independent panel of scientists concluded that the public health risks of exposure to toxic air contaminants are most significant within that half a mile. And so we have, communities that are, 3 to 4 steps away from oil and gas development. There's communities where actually they don't even know that there's oil extraction happening, because one of the conditions of the permit for many of these facilities is that they would be well landscaped and manicured. So, and Los Angeles has a tradition of hiding our urban oil wells in plain sight. Next slide. So, when I was a kid, we would see pump jacks, painted like animals, like a giraffe or so we grew up around them. We didn't think twice. The high school I went to, they had oil wells next door. We had capped wells under the football field. Can you advance the next slide? So, at greatest risk are people of color. There's 1,071 active wells in the city of Los Angeles. 759 of those wells are located within 1,500 feet of a home, a church, a school, or a hospital. 74% of the residents who live within these 1,500 foot are people of color. So we know that this is fundamentally a human rights, environmental justice, and economic justice issue. Next slide. So so we know that the stuff is happening in Los Angeles. What makes it different from New York and other places back east is, again, how it's intimately tied with our economy. Next slide. So I talked to you about the first. So these are actual pictures of Los Angeles at the turn of the last century, and you could see again the history of oil and sort of how it's tied to LA. Emma Summers is one of my favorites. She's one of the first millionaires, women millionaires in LA, made her money on oil. That's our beautiful coastline, dotted with fields. The little insert in the middle is actually where my neighborhood is, sort of Echo Park neighborhood, which also had major fields underneath. Those communities, what's the map that's coming up is actually, next slide, a map of all the existing capped wells in Los Angeles. So you can see when that map comes up, you will see that they're all over the city. And so you want to make a distinction between the wells that are in the city. There you go. So that's Los Angeles. This is from Dogger. This map is from Dogger, the Division of Oil and Gas Regulation. And you could see the number of wells. And you could see, again, they're in traditionally communities of color, such as Inglewood, Vernon, East Los Angeles, Echo Park, which is now one of the most gentrified communities in the country. Most people who live there don't realize that underneath the ground there was lots of oil. Next slide. So the county also has a number of wells. So the city of LA, then there's the county of LA, and within the county there's a number of unincorporated cities. There's about 5,000 wells in the city. 70% of those wells are within 1,500 foot, and 50% of the census tracts are in the most heavily polluted communities. So in California, we have a tool called EnviroScreen that identifies the most polluted communities in the county throughout the state. And again, these oil wells are where they're really the birth of LA's environmental justice problems, because we had racial covenants that made it difficult for people to buy, and so in some areas, like the Inglewood oil fields, that was the only place that African Americans could buy property, and now that is an expanding field. Next slide. So for us with Stand LA, which is Standing Together Neighborhood Drilling, we have come to understand that that our work really is around making health a top priority. And we see in the next slide that's coming up that between Los Angeles and Kern County, those are the top producers of oil. We are dwarfed by what's happening in Kern County, and you will hear about it later. But this is what oil extraction looks like in Los Angeles. That's my high school. That's the field. The larger arrow is where we have, you see the inserts. There is wells there that are now currently being reworked. And if you see the next slide, this is the one that you might have heard about in the news. This is the next slide up will be the Alanco facility. Highly dense, very densely populated. 25% of the population is under the age of 5. There is a Mount St. Mary's College, a high school. That Mount St. Mary's is a school primarily of young women. So it's you've got highly toxic chemicals being used next to women of childbearing age, and around a lot of children and in their schools. The next slide. And so again, we continue to see. You can go through the rest of them at the normal speed. So again, this is where people live. They're highly densely populated. So you see the University Park, Alanco. 90% are renters. So again, you have, I'm trying to tell you the story of who lives there, that it's, people are very vulnerable. They're renters. They don't have a lot of control over what gets done in their housing or in their communities. And every single one of those communities, Alanco, Jefferson, Murphy, Warren, and Wilmington, and Baldwin Hills. Baldwin Hills is the only one that has, higher income and more home ownership in some of those areas. Next slide. Now, again, this is a CalEnviroScreen map, and it shows you the blue lines are where our the oil fields are. The red is the top 5 most polluted communities, and the lighter pink is the highest 10%. So again, you see this overlay between environmental justice and where we're where we continue to pull oil out of the ground, and where we've decided that in Los Angeles, we're actually going to expand how much oil we're putting out of the ground. Next slide. And they tell us nothing to worry about. And the next set of pictures you're going to see, and we can go through them quickly, are just a smattering of the types of incidents that occur as they relate to oil and gas. So not only do we have the day-to-day operations and those emissions, but we have to worry about accidents. Refinery accidents often happen, and workers and communities are exposed. Pipeline breakages. Again, communities, first responders are at greatest risk. Then think about, we're moving these fossil fuels through trucks, and we're also moving trucks full of hydrochloric and hydrofluoric acid through communities. So we often see incidents like this. And then there's the mother of all of them. This is infrared of the natural gas leak at Aliso Canyon. So these incidences are a regular part of operations, yet there are no emergency response plans, no community evacuations. And while Porter Ranch got a lot of media attention and people got evacuated, the folks at the other 5 sites that we're working with over the last 5 or 6 years, where they've been expanding oil extraction, no relief, no health studies, no evacuation, no emergency response plans, and no real response from any regulatory agency. And what has made our groups come together, it has really been fundamentally about community health. So here you have a set of community health promoters who are talking about the health impacts. We know that the chemicals that are being used actually reflect the impacts that we're seeing on the ground. So silica, methanol, hydrochloric acid, hydrofluoric. So we're seeing eye irritants, respiratory irritants, and endocrine disruptors that are being used on these chemicals on these sites. And that's the pattern of diseases that we are seeing in those communities. Here's the chemicals that were used in the reported through SB4, which required reporting. And here's a really important one. We acidized 170 wells, we gravel packed 95, and we only fracked 11 wells in 2014. So fracking is not what's happening in Los Angeles. It is traditional oil extraction that's expanding, as well as acidization. And and really who has stood by communities and protected them. The next slide. It has been really a public outcry. It wasn't until the LA Times finally did a story on Alanco that Barbara Boxer came to the rescue, but no local folks came to the rescue. And so Alanco has been closed, and lo and behold, the community that lives near Alanco has stopped complaining of many of the health impacts. And in fact, those residents are doing, the community advocates, they are going door to door doing health impact health interviews to see how people are feeling since that facility has been closed for over 2 years now. And we're in constant fear of it reopening. Next slide. And lately, we've gotten some support. So last week, Stand LA actually was able to work with Hollywood United, and we took Mr. Ruffalo and Mr. DiCaprio on a tour of these sites. They were blown away, and that's Mr. DiCaprio's tweet. And if you saw the Oscars and you heard his acceptance speech, we believe that he was very much moved by the environmental and human rights injustices happening through urban oil drilling. And then Mark Ruffalo, my new best friend, is really wonderful, and he is going to be, I think he was really moved, and as were many other folks, and we hope to continue to work with them. Next slide. To help us push for a 1,500-foot buffer in Los Angeles, and we invite you to stand together with Los Angeles and join Stan in calling for an end to urban oil drilling. Thank you.
Thank you, Marta. Now I'm going to turn it over to Juan.
Hi, thank you, and thank you everyone for joining us on this webinar today. I live in the Central Valley of California, in the county of Kern, which is perhaps the #1 fracking county in California. And I shouldn't say perhaps, it is. 99% of the fracking permits that are disclosed come to Kern County. I was trying to get some definite numbers for you guys in comparison to what other counties get, but I wasn't able to access them at their webpage, at the state's webpage. But to give you kind of an idea of how much fracking we do here in Kern County, in 2016, we had there were 1,247 permits given to frack. And out of those, 1,245 were for Kern County. And one was for Ventura County, and then the other one was for LA County. So that's how much of fracking we're doing in comparison to LA, as Marta mentioned it. We are the kings of fracking. This is where it's happening. Kern County is the #1 oil producing county in the United States, and California is the 3rd oil producer in the whole country. And this brings us to one of the most impactful parts of this, which is the health in children and in adults. And I have to make it very clear that the one group that we're focusing a lot here, obviously we're focusing about every single individual in Kern County, but we're focusing a lot on the children. 22% of children ages 1 through 17 suffer from asthma, and this is sad. Some time ago, I was visiting this school in the community of Chapter here in Kern County, and there were some kids playing very close to the fence. And on the other side of the school, we have a community garden that the Center on Race, Poverty, and Environment helped develop. And when these children were playing, I got really close to them, and I asked them, I said, hey guys, how many of you guys do have asthma? And they looked at me and they said, why, you don't have asthma? And I said, no, I really don't. And they asked me, well, how does that feel? That broke my heart. These were children that must have been 3rd, 4th graders, and they have grown accustomed to have asthma. And it's like, well, this is the way we were born, and I think that this is how everybody is supposed to be born, when they could have a better life, when they could have a life where they don't have an asthma attack every other day. There was this kid that, this child that was telling me that he gets rushed into the hospital. His family has to drive him all the way to Bakersfield. They have to drive 20 miles just to go to the hospital on the asthma attacks that he gets. And that happens at least once every 2 weeks. And he was telling me how he knows the doctors and the nurses, and he already knows what they're going to do to him when he gets to the emergency room. And that's really sad. And it is sad because here in California, we don't have any setback limits. As you see on the picture right there, you have the elementary school, the playground, and then within 200 yards, you have an oil well. Now, that's only one of the 3 oil wells that are surrounding that school right there. And it is sad. If the industry wants to drill an oil well right on the children's playground, they could actually do it. They haven't done it, God only knows why, but if they could actually put it right inside of that school, they would actually do it. When you come to Bakersfield, here in Kern County, you could actually see oil wells right on the same parking lots of restaurants, banks, hotels, because that's how much power this industry has. But luckily and thankfully, there is a group of community members here in Kern County that are doing a magnificent fight against this industry. We call it a David versus Goliath type of fight. And I'll give you one example. For instance, the people that you see in the picture are part of what we call the anti-fracking committee, and their annual budget runs about $500. And that's what we all pitch in, to make flyers, to do all these other things that we have to do in order to educate our communities, while the oil industry puts upfront last year alone in Kern County close to $7 million in TV ads, newspaper ads, radio ads, everything. And what we have to do is literally we have to go and beg on these informational talk shows that we have on the local radio and ask them if they could give us 15 minutes just to talk really quick about fracking. Some of them tell us, what, we can because it's fracking, it's the oil industry, and the owner of the radio station owns, some assets within the oil industry. So this committee does completely a full schedule of activities. They have bi-weekly meetings. Past November, they were fasting outside of the Board of Supervisors, asking them to put a ban on fracking. And 2 days later, after they were done with their fasting, the answer from the Board of Supervisors was to just stamp every single permit that they had on their desk about fracking. And they actually introduced a new county ordinance that allows the permits to go faster and more cheaply for the oil industry. But that doesn't make us feel bad. That only gives us more strength to keep on going on this fight. There's 2 lawsuits that we have right now. One lawsuit is against Governor Brown. That's the Romo versus Brown case that we have. And that's the case of Rodrigo Romo that is suing Governor Brown because of his daughter, who at 13 years old, she was diagnosed with epilepsy when she had been a basketball player, a softball player, a soccer player, and all of a sudden she started fainting and she started having these massive headaches, and they didn't know what was wrong with her. At the same time that she was suffering from this, one of her classmates and a really close friend of her started suffering from the same symptoms. Sadly, her classmate passed away, and it took, up to this date, after she passed, the doctors kept her body for about a month trying to find out the cause of her death. I mean, a 13-year-old, she was really healthy, she was in sports, she was in activities, and all of a sudden she died. And at the end, the doctor literally told the family, listen, all I can tell you is that I don't know what she died of, but I have to write something in order for me to release the body to you. And I'm going to put that she died out of a massive heart attack. So Rodrigo's daughter was very afraid. She said, Dad, I have the same symptoms as my classmate. Am I going to die too? So Rodrigo said, you know what, Juan, this is not fair that our children in this community have to suffer those psychological impacts. So Rodrigo went on and said, I wanna put a lawsuit against Governor Brown. Would any of your guys' lawyers help me out? And we said, definitely, we can totally back you up on this one. And he's representing a group of Latino parents who are actually the ones that joined as well this lawsuit with him. And then we also have another lawsuit against Kern County because of the ordinance that they introduced in November to fast-track these permits for the oil industry. Now, with this being said, this takes us to another part of Kern County, which is agriculture. Oil and agriculture in Kern County go hand in hand, and this is something with Rodrigo's story and the subcommittee story, that's kind of the local issues that we have here. But on agriculture, this is something that all of us have to be aware and that we have to be conscious about. And it's because Kern County, well, the Central Valley of California is considered a food basket of the nation. 25% of the vegetables, fruits, nuts, and dairy products that we consume nationwide are produced right here in California in the Central Valley. Kern County is the fourth major agricultural producer. At the same time, that Kern County is the #1 oil producer. When fracking happens, probably some of you guys know already this, and some of you guys might not know this. But when fracking is happening, they inject so much water with so much chemicals and sand that all of that has to rebound back to the earth. And those are the pictures that you're seeing there, that dirty water. We call that produced water. Now, there's more than 100 farmers right now locally in Kern County that are irrigating their crops with this water right here. So if this morning you had a salad and you put some almonds on it, some raisins on them, if you had some dessert and you had a cup of grapes, if you were driving and you wanted to eat some pistachios this morning and you actually ate them and they were from California, more chances are that the water that you're seeing right now was used to irrigate the crops of the fruits, nuts, and even the water that some of the alfalfa that the cows are eating are being irrigated with. So this is a major concern. That should be a major concern to all of us. Why? Because as Martha was saying, the chemicals that we have found in some of this water are blow mind. They would completely open your eyes to say, what the hell is going on? Why are we allowing this to happen in this country? Look at that pictures. Look at that water. Those are pictures that we are so familiar to see with other countries that we so-called third world countries. Well, this is in California, and this is happening on the United States. On what is known and what we are proud to call the greatest nation on earth. But should residents of this great nation have to eat and drink products that are being irrigated with this water? I don't think so. So I think that this should be an eye-opener for all of us to come together, to join forces, and to finally say to the oil industry, enough is enough. We can no longer follow this path of consuming so much oil. We need to start looking at other resources. We have to start looking at renewable energy. We have to start looking at other ways, even of doing farming, in order to protect our health. And with that, I'm gonna give it over to Sahur. Thank you.
Thank you, Juan, and I'm going to turn it over to Karen.
Thank you so much. I'm happy to be part of all of this to share with you what's going on here in Pennsylvania. It's the state that we refer to as the if you don't want to know, don't look state, and that's because we've been feeling like test subjects in a live laboratory experiment for 13 years now since fracking first began in our state. We have a state government that's absolutely checked out on what's going on, and so many of the things we just heard about from the other speakers are things that are happening here too, where gas fracking is what we do primarily. But you know, we have both parties in an office are very, very enthusiastic about fracking, and so they really don't want to see problems that they don't want to have to deal with. But before I go on and tell you a little bit more about that, I just wanted to show you what we're talking about here. In first slide, here is the Marcellus Shale. If you've heard about what's going on in Pennsylvania, you're familiar with the Marcellus Shale. It's the place that they've been going after gas for a long time, but now that gas prices have been going down, they're increasingly looking at a formation called the Utica Shale. If you could see the things to scale, you would see that the Utica Shale, which sits a lot deeper and where they go after oil extraction, you could see, if you could see the images together, that they actually occupy the same part of the state. And so we're talking about communities that have been hammered over and over and over again by fracking, whether it's for gas or for oil. Here's another way of looking at it. This is an animation of the unconventional wells that have been permitted over the years, and this is a little bit out of date actually, because I wanted to use the animation, but the most recent one shows 16,000 plus wells. We now have 17,000 plus wells permitted in the state, and you can see how it fills in certain areas of the state to the point that you can't even make out the counties anymore. Well, of those 17,000 that have been permitted, 9,652 have been drilled. That doesn't even represent a tenth of what the industry wants to put here in Pennsylvania. They want to put over 100,000 wells in the state. And at the same time that you see that, and you understand that the communities that have already been hit are going to continue to be hit over and over again, you see a big portion of the state where there are no wells. Now, it's either because we are not sitting on top of gas that they've found yet anyway, or because we're protected by a moratorium. In fact, there are wealthy suburbs of Philadelphia, which is in the southeastern corner of the state that you can't see because of the legend there, where they found gas that they've been wanting to go after but haven't been able to go after it because we're protected by a moratorium. And in fact, a Republican state senator put in place a moratorium on fracking in his own district, but didn't care so much about the parts of the state you're looking at right now. Now, that's not to say that we're not impacted at all. There's a lot of infrastructure build out that comes on the heels of all this fracking, and so we are in the path of pipelines and compressor stations, natural gas power plants, processing plants, and so we have been impacted. This is now a Pennsylvania problem. However, it would be unfair and absolutely necessary to make sure that I tell you that if we are being impacted in this part of the state, it doesn't even hold a candle to the way people in the shale fields are being impacted. So it's only fair to share that with you, because what they have experienced is just absolutely ungodly. They have health impacts that I'll get into a little bit, but they have all sorts of other problems with environmental degradation and quality of life issues and reduced property values. So they've been hit in every imaginable direction, but they have experienced over the years many, many health impacts that we don't know as much about as we'd like to, but we're starting to catch up. But they report everything from nosebleeds and a rash that's so common they refer to it as frack rash, and everything from that up to cancers and severe respiratory problems. The science is backing up what those people are saying. It used to be that there were only a handful of studies available on fracking. When the first well went into Pennsylvania, there were only 6 studies. But the infographic you see there on the left comes from physician scientists and engineers for healthy energy. They started analyzing the studies on fracking back in December of 2014. This infographic you're looking at accompanies their July 2015 update, where they looked at 550 plus studies. So over the years, the volume of research has increased enormously, and you see some percentages there: health 84%, water quality 69%, air quality 88%. What those percentages refer to are the percentages of studies that they found in those different categories that show either negative impacts that are already occurring or have the potential to occur, and maybe even the likelihood of occurring. And so there's a new version of this coming out. It's not out yet, but I heard from the authors that we now have over 680 studies on fracking, and that those percentages are still pretty much in the same ballpark. And so what we're seeing is that the science is overwhelmingly telling us that we have to stop fracking. We have been the subject of a lot of the studies here in Pennsylvania. There's mounting evidence that I borrowed from the Philadelphia Inquirer, where they highlighted a couple of the stories that are the studies that happened here in Pennsylvania. But we happen to be the subject of lots of studies, and in fact, we are featured in many other studies where they've looked at multiple states. So, you know, Pennsylvania data shows up in a lot of the research that's been done, but these two happened last summer. This one on the southwestern part of the state looks at low birth weight And in fact, they also found high-risk pregnancies in that study in southwestern Pennsylvania. And then in the Northeast, they found an increased incidence of hospitalization rates for things like cancer, cardiac issues and neurological conditions, all in proximity of drilling, whether it's low birth weight or increased hospitalization rates, it's all in proximity of drilling. And so there's a high level of correlation that has gone on. It's taking a while to establish causality, and so we continue to wait, but we hear stories constantly from people in the ground who are telling us that, you know, they're suffering a wide variety of illnesses that we are increasingly concerned about. Moratorium sandwich, here's the name of my next slide, because Pennsylvania kind of is one. To our north is New York State. To our south is Maryland. Now, New York State, when they had the opportunity to start drilling back when we decided to let it happen in our state, they took a more measured approach, and they thought we should do a study before we decide, you know, whether we should open up the state and expose our people to what goes on when fracking occurs. And so they spent more than 4,000 hours doing a health study that was presented to Governor Cuomo in December of 2014. That's when he put an outright ban on fracking, based on the results of what they found in their health study. Maryland did a health study prior to putting their moratorium in place, but the state to our south now has a 2.5-year moratorium in place. But something else happened that influenced their decision as well, and that has to do with a little town in Pennsylvania called Dimock, which some of you may have heard of. It's sort of been Pennsylvania's ground zero for some time now. One person in Dimock, who I know, has hosted media teams from over 40 countries, because the eyes of the world have been on Pennsylvania in general as a negative role model on fracking, but on Dimock specifically. And so lots and lots of people, not just media teams, have gone to Dimock to see what's going on there, including legislators from New York State and from Maryland who visited Dimock, saw what was going on, turned on their heels, and went back to their states to pass moratorium bills. However, no sitting governor in Pennsylvania has ever visited an impacted community, Dimock or any others. And that's really saying something, and it's not just the governor, it's our legislators, it's our regulatory agencies. They're just absolutely checked out. So while New York State was spending 4,000 hours on a health study, our Department of Health in Pennsylvania was handing out a buzzwords list. What you're looking at here is a list that were handed to staffers with instructions that they should not engage with people calling up to register fracking-related health complaints if they used any of the terms on the list. And so what you see on the left is the actual list. It's an excerpt from the memo that went out to the Department of Health staffers. On the right, you see the full list so you can see it more easily. But they're the words there: fracking, Marcellus shale, skin rash, hair falling out, wastewater, frack chemicals, and the rest. And so we have a situation here where we have a Department of Health that is not attending to the needs of the people. In fact, they've been actively avoiding attending to the needs of the people of Pennsylvania. And so after that story came out, I started working with Stan Bernhardt at Food and Water Watch, who's the state organizer here in Pennsylvania for that organization. We started interviewing impacted people to find out what their experience had been when they called the Department of Health. Did they have the experience that would match what you would expect if the person on the other end of the phone was holding onto a buzzwords list? And to a person, that's exactly what we found. And so we gathered together some of those people who gave us their stories and called on the Attorney General's office to investigate. That investigation is still ongoing. So in the meantime, Food and Water Watch submitted a right-to-know request of the Department of Health to turn over all the records that they said that they'd been maintaining. Once the story came out, and once they could no longer deny that there was a buzzwords list, once it was published, the spokeswoman for the department said that they'd been maintaining records for years and had 51 records over a span of years. But they said that, in fact, none of those issues turned out to be fracking related in the end. Well, based on what? The people we talked to weren't even getting calls back from the agency. And in fact, when Food and Water Watch finally got through the legal wrangling to get those documents from the Department of Health, they found out that what we were hearing from the people was backed up by what was in those records. There were records that said that no further action was required, even though no action had been taken. Or we found that some of the records said that they contacted the Department of Environmental Protection to get some help with some additional testing, and that agency just said no, so that was the end of it. There were even cases where individuals' problems or complaints were conflated into one record. So there would be elements of different people's stories in one record. It was a mess what came out of our Department of Health. And so they published an analysis that I've provided a link to in a minute that I can show you, but we started meeting with the governor and with the physician general, the secretary of the Department of Health, the secretary of the Department of Environmental Protection, and other members of the cabinet to talk about what has been happening. And we took with us impacted people every time we had a meeting who would tell people to their faces what they'd been experiencing. We also took scientists with us. We took Dr. Sandra Steingraber and Dr. Robert Howarth from Cornell University. We took Dr. Yuri Gorby from Rensselaer Polytechnic and Dr. Kathy Nolan from Catskill Mountain Keeper, who could sit there and back up with the science what they were hearing from people on the ground who were experiencing these problems. And so our governor, who's only been in office for a year, is very enthusiastic about fracking, as they all have been, and he wants to put in place a health registry. That's his great solution, but that's a good solution for 2003 when it started. It's not a great solution for 2016, because what we've been trying to explain to our government officials is this: these people that we're bringing with us are people who were counted. They are people who contacted the Department of Health, and they've still gotten no help. And so we're determined to get everybody in Pennsylvania who needs help the help that they really deserve. And we are determined to not stop until we've ended fracking. And so the last slide I wanted to show you is a list of links. I referred to one of them a second ago. If you want to read that analysis, it's the first link there. But these are other links that are useful resources that you can use if you're fighting fracking in your communities, things that you can show to your elected officials and your press and your members of the public just to get them informed. And then finally, I provided a slide with my contact information should you want to reach me and ask me any questions, but I'll be happy to take whatever questions I can during the Q&A. So thank you so much for your attention.
Thank you so much, Karen. And we're going to get to everyone's questions in a minute. And before we do, I just want to talk a little bit about how you can get involved with Breast Cancer Action if you're interested. You can sign up to be a member and get our news and action e-alerts, which can tell you about our webinars, about our actions, about things happening all across the country related to all the different areas that we work on, including the anti-fracking movement. You can join us on Facebook and Twitter to connect with others and help change the conversation about the breast cancer epidemic. You can also help others get involved. You can tell your friends, coworkers, and family about this webinar and ways that they can get involved. And last, you can donate to support our education and advocacy work. So again, on that note, reminding you that Breast Cancer Action really relies on your support to make our work possible, including these webinars, and your individual support is crucial. If you've been inspired today, please consider making a donation of $25 or more so we can continue these webinars. I want to really give a big thank you to Marta, to Juan, to Karen for their presentations today. And now we're going to take the last 10 minutes to answer the questions that you have on anything the speakers talked about today. So again, I want to remind you that there is a question bar that you can type in your questions as I will take the questions that we've got already, but please continue to type in your questions. So the first question is to Marta. Someone asks, does the California Department of Health get involved in the field responding to health complaints or environmental complaints with the Department of Environmental Protection?
No, and we wish they would. And that's actually where I think our advocacy is going. We are fortunate to have an Office of Health Equity, and we've had some initial conversations, and there's interest, but it's spotty. And so, for example, in Los Angeles, we had a public health official saying, if Alanco is operating under all of its permits and it's meeting its conditions and the community is getting sick, then there's a problem with the regulation because we have a public health problem. We all did a happy dance when we heard that. But we have not. That has not been a consistent message from the county health department, and we are in the midst right now of actually having a more specific health organizing strategy in California. And we are at PSR. We're balancing very much the local work that we're incredibly committed to, with sort of having an eye toward what's happening throughout the rest of the state.
Great, thanks, Marta. And Juan, someone asks if you could describe if you know about the Citizen Air Monitoring Project in Kern County, and if you could describe and talk a little bit more about that, if you know.
I don't know directly. I have heard about them. We have a couple of organizations that are doing that work here. My colleagues, Roxana Esparza and Gustavo Guerrero Jr. Would be the ones that know more about that, but we are working to coordinate efforts together. They join us a lot on all the activities that we have.
And what organization are they from?
Roxana Esparza is with Clean Water Action, if I'm not mistaken, and Gustavo is part of a coalition that is the California Central Justice Alliance Network.
Okay, wonderful, thank you. So there's a question, sort of maybe all three of you can take a stab at answering it, but we have a number of people asking, you know, what can I do as an individual? How can I get involved? Where can I make change? Maybe Karen, if you want to start.
Sure. Well, you've heard about organizations that we all represent, and there are lots more. Certainly, if you can spend time getting involved yourself and working with us on some of the actions that we take. Sometimes we have large rallies where we can use as many people as possible to help us. If you can't do that, if you can make financial contributions like the one Breast Cancer Action talked about, those are always helpful. But I would say that there are lots and lots of organizations out there looking for your help in one way or the other. And certainly, I really think that we win this once we've convince the public that it's something that has to happen. I think we can move mountains if we can move the public. And so everybody who's willing to share stories like this and, you know, talk it up with their neighbors and talk it up with their friends, I think that's what will ultimately persuade elected officials and others to follow what their constituents are telling them to do.
Great. Marta?
I think that's exactly right. You can go, if you're in Los Angeles, you can go to the Stand LA website and you can become a partner or a supporter or an ambassador, as we have levels of engagement. But I can't emphasize enough, wherever you are, calling your local elected officials, letting them know that this is an issue that's important to you, letting them know that, and the other part is really being clear on the message, because we don't want this better regulated. We just think that this should not be happening where people live. And so being careful about saying, you know, we have a vision for a just transition away from fossil fuels, and that's what we need to do. So I think that, and again, there's lots of organizations and supporting them. We're doing a lot of coalition building with other groups like 350.org and others. So there's more than enough opportunities for you to get involved.
Great. And Juan, your thoughts?
Definitely, I agree 100% with Marta and Karen. And as Karen had mentioned, help us educate your communities, help us educate your families, your friends. Well, I live in California. I don't know where all of you guys are at, but I'm assuming that you guys are all across the country. Help us educate, help us take this message everywhere. Like I think all of us have said, these are not local problems. These are problems that are going to affect all of us at one point. But we can prevent that if we start educating each one.
Great, thank you. And I want to just say, give a plug for a way that Breast Cancer Action is involving our members and the public in the anti-fracking movement here is a program we have called the California Cancer Fractivists, which is helping to provide tools and support to members in California who are interested in getting involved, and so helping connect them and support them in fighting for a ban on fracking and other dangerous oil and gas extraction methods like Marta talked about in California. And I also just want to say that I will be sending a follow-up email to everyone who registered for this webinar, and I will include the resources that all of the presenters had, so you will get that. We also record our webinars and make them available on our website if you want to refer to it again or send a friend or someone in your community to listen to it. So there is a question, and this would probably be either for Juan or Marta because it's California specific, but someone is mentioning that Prop 65, which is the sort of famous warning law in California, also protects waters of the state that are polluted by industry and individuals, but it's not really enforceable except by litigation. And they're wondering if, since fracking is exempt to the Clean Water Act, if there's any litigation that can happen via Prop 65 that can be used in California to stop fracking wastewater injections or the wastewater being used to irrigate agriculture. So I'll put that to Marta or Juan or both if you have a comment.
Yeah, I wish I knew more about Prop 65 than I do, but I know that there's been a couple of folks who have been asking that question, and we have in LA, I'm going to actually bring that up to our legal team, because we've been doing in LA, we actually have been doing some litigation around unequal protection. So youth in 2 communities filed a lawsuit against the city because in richer parts of LA, they have better protection. So we've gone that route, but not the Prop 65 route.
Juan, do you have thoughts?
I have not, as well as Marta. I wish I had more knowledge about Prop 65, but I already made myself a note. I'm going to ask both of my lawyers, Sophia and Madeline, to see how we can use Prop 65 in litigation. I'm assuming that is something that they had already discussed, but it could be something that it went by. I mean, there's so many things happening that this could be one of those things that we haven't paid attention or looked at the moment, but I'll definitely follow up with them.
Great. Well, thank you for that question. There is a question about, Karen, for you, if sort of thinking about the work that you do in Pennsylvania, and how do you feel like the sort of what's going on with the fracking situation in Pennsylvania, how is it similar or different to what's going on in California versus Colorado versus Florida versus other parts of the country, if you have thoughts on that?
Yeah, actually, I was fortunate to be one of the people who could go to Paris for the climate talks, but I was at an anti-fracking conference in Paris where we were hearing from people from around the world, and the thing that always strikes me is that it's the same story. So the techniques may be different, the end product that they're going after may be different, but what it's doing to communities, regardless of where it's being done, is very, very similar. And so I think a lot of the work needs to be very similar that we do wherever we are. And I think we've been very fortunate to, with virtually no resources compared to what this industry has, we've been able to, make strides and stop a lot of the bad things that they've wanted to do. In a place like Pennsylvania where we ultimately want to ban it, we still have to be on our toes like they do in California every day to make sure that the next bad idea that they have isn't implemented. So we're constantly going after the bad idea of the moment and fighting, 1,000 different fights. Like Juan just said, everybody's so busy. We're all stretched very, very thin, but I think we've done amazing things. And so, I think it's been very, very useful to form, for instance, here in Pennsylvania, a statewide coalition like Pennsylvanians Against Fracking, where we can speak with one voice and drive the narrative sometimes in a way that you don't get to when you're, fighting each battle in your own community day by day. You need to have that kind of voice where you can kind of drive what the story is instead of just constantly being in a reactive mode. And so I think that I've been seeing lots more of that, and I'm feeling very optimistic, actually. I feel like we've turned a corner as a movement.
Great. Thank you so much. I want to thank, again, all of our presenters, and I want to thank everyone on the call for your thoughtful questions and comments. And if we didn't get to your question today, you can follow up with us at info@bcaction.org. Thank you again for attending, and I will be sending out an email, again, with those resources and also a short survey where you can provide some feedback on this webinar. So thank you again, and have a wonderful rest of your day and evening.